Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF. K. 616-9538. Unit 7, Develop and Implement Reactive Monitoring Systems for Health and Safety. Enhanced Limited Copyright 2019. Loss events. Some health and safety loss events include lost time events where an accident occurs and results in the employee being absent for a minimum of 1 day, damage to plant, equipment or the area of work. What to include in loss report forms: who, what, where, when. Any witness reports. Procedure of reporting and recording. The procedure could include a multiple-step process, setting roles and responsibilities for this particular event, having a direct link to the emergency services and reporting it to a regulatory body, such as the Health and Safety Executive, HSE. The recording of these could be done on paper or electronic devices. The records could include extra information to support the accident, for example photographs, testimonies, floor plans. Does the events require a formal investigation? Yes, in cases where the events are associated with RIDDOR requirements, involve fire, involve escape of toxic fumes, involve falls from height, involve loss of consciousness, lead to the person who sustained the injury being incapacitated for 3 days or more, involve loss of sight, involve fractures, lead to multiple injuries. RIDDOR requirements. RIDDOR is the law that means the head of businesses have to keep a record of accidents which result in fatality, accidents which result in serious injury, cases which have been diagnosed of industrial diseases, incidents which could be potentially harmful. From October 2013, the list of major injuries was simplified to a list of specific injuries, the types of industrial disease was shortened to 8 and the number of incidents that were considered potentially harmful was lowered. Creating an investigation kit. This may include the roles and responsibilities of individuals, access to safety equipment, access to equipment for recording the accident, for example a camera, health and safety records, etc. Conducting an investigation. Collect the required people for the investigation. Gather your investigation kit that has been prepared previously. Go to where the incident occurred. Provide medical help if necessary. Secure and preserve the area. Gather witnesses/workers involved and conduct interviews. Document the scene. Create and distribute the incident investigation report. Use the findings to improve the hazard control. Ensure these improvements are put into place. Implementing recommendations of investigations. There are several ways to follow the recommendations of an investigation. These include assigning new roles and responsibilities to individuals, creating timescales, this could improve concentration, monitoring progress after the accident, conducting meetings to discuss any queries, annually reviewing the incident reports to notice any differences. Collecting and presenting data. Data could be gathered from records, spreadsheets, sampling results, investigation results. It could be presented by graphs, images, notes. Outcomes of monitoring. Monitoring the area allows for businesses to see if they are improving the standard of health and safety. It can also gather causes, impact, equipment, failure, human factors, environmental factors and task-related factors. This means that the company can further investigate the incident if needed. It also allows them to improve further in terms of health and safety. The outcomes should be explained to directors, senior line, technical managers, representatives and employees. This should be done in hope of fewer injuries and more awareness. What to contain in a report of the outcomes. Brief synopsis. Findings in depth. Recorded data, for example graphs, charts. Recommendations on how to improve further. Costings of the procedure. Timescales, roles and responsibilities. The report can be written and/or verbal. Recommendations. Suggestions could be made about the plant equipment, employees and locations. Risk assessments, training and supervision could be reconsidered. They may need updating to meet current health and safety standard. Requirements of authorities. Health and Safety at Work etc. Act 1974, HSAWA. Management of Health and Safety Regulations. RIDOR. Provision and Use of Work Equipment Regulations 1998, PUA. Specific regulations to workplace or organization. Why monitor systems? Monitoring systems is done in hope of reducing or eliminating accidents. It helps to prevent unnecessary health and safety issues. By monitoring systems, it allows your workforce to have the highest amount of safety possible. This is due to it acting as a proactive warning routine. Furthermore, it means that the organization has a positive health and safety culture. This is due to the fact that they are actively looking for ways to prevent injury. Principles of a fault tree analysis. A fault tree shows the correlation between failures and other events within a system. FTA has 5 steps. Gain an understanding of the system. Choose the event to study. Make the FTA. Evaluate the diagram. Analyze and evaluate the reliability of the FTA. Principles of events and causal factors analysis. Problem statements are helpful, and are usually required to find the root causes of an incident. A timeline should be established. This will help to form an understanding between the causes and the problem under investigation. Graphing should be key factor of this process. Needs to be systematic. A team effort is necessary when carrying out an investigation, as this will allow the process to be more effective. Principles of effective communication. Identify your audience, purpose and topic. Anticipate opposition. Try not to be subjective. Deliver communication through several methods. Establish a practical way to receive feedback. Try not to communicate a large amount of information at one time. Principles of statistical and epidemiological analyses of data. Be familiar with the business and the data given. Define the purpose of the analysis. Look at the data from several different perspectives. This can help to discover new insights. Have knowledge of how the data was collected. General principles of graphing data. Choose the most efficient method to convey the message data. Important aspects should be emphasized. Complex and simple data should be included. Use Weber's law, which states that the likelihood of the eye detecting a difference of lines is dependent on the ratio of the two lengths. Aspect ratio does not have to be equal. Keep variables continuous and avoid grouping them into intervals. Principles of histograms. Time is represented on the x-axis. Frequency is represented on the y-axis. Choose an appropriate time interval. The area of each bar shows the frequency density of each time interval. Principles of pie charts. Each section represents a proportion of the data collected for a particular group. Try to avoid using a pie chart if there is only a small difference between each interval. It is useful to order the data from the largest to the smallest. No more than 6 components should be displayed within a pie chart. Principles of cumulative sum graphs. Sum graphs are used to monitor target of a system in comparison to the expected target. An event that happens frequently is most efficient for this method to be used. It allows areas that may be above or below target of the organization's health and safety culture to be seen. Principles of line graphs. The independent variable is the x-axis and the dependent is the y-axis. Ensure that the axes are labeled simply and clearly. Labels should be parallel with the axes. Give the graph a suitable title and a figure number. Place the graph after the text which refers to it. External factors. External factors can include a change of nationwide EU legislation, changes of councils and governments, and guidance from authorities and health and safety professionals and incidents. Health and safety statutory and common law. When thinking about these, you may want to consider differences between common law, precedents, weight of evidence, torts, civil wrong, Negligence and statute law. Legislature. Powers of regulatory authorities. Penalties. Court procedures. Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF.